Hello, good evening, one and all. So, welcome to our YouTube channel, IIT Pharma. So, myself, Krishna. In this video, we are going to learn some key points on chloramphenicol antibiotic. So, coming coming back to the chloramphenicol topic. So, what is chloramphenicol? So, chloramphenicol it is an antibiotic. Okay, it is generally obtained from bacteria Streptomyces venezuelae. Okay, after that, it is an yellowish white crystalline solid, and when we make its aqueous solution, that aqueous solution it is a quite stable, but it should be need to be protected from the light. So in this you have to just remember 2 points, that is its source. It is very important on the point of view of GPAT examination, because most of the probably the examiner ask what is the basically the source of chloramphenicol, then you have to go for Streptomyces venezuelae. And after that, one more question it can arises that what is that Streptomyces venezuelae? It is a bacteria, fungi, or any type of like microorganism. So you have to just correct that it is one of the bacteria. Okay, na? So there are some points that are hidden in its name itself only. Okay, na? So when we just figure out that words, like from chloramphenicol, that is ORA. So you have to just remember that its absorption is oral absorption of chloramphenicol, where it is ORA. Okay, after that, from P, from this P word, we can find out that its mechanism of action is that it generally binds to P side. Okay, now. So chloramphenicol, it binds to 50s ribosomes, and it interferes with the peptide bond formation and transfer of peptide chain from the P side. Okay, you have to just remember this point. After that, when we just go to chemistry portion, this is generally a basic ring of that chloramphenicol. This is the basic structure of chloramphenicol. So what are the key points, or what is basically the structure that plays the key role in order to show that mechanism of action of that antibacterial. Okay, na? So in this structure, this nitrobenzene group, this one, it is very responsible for antibacterial activity and its bitter taste. Okay, so from chemistry point of view, an examiner can ask you like which is the basic moiety that is present in chloramphenicol that is responsible for antibacterial action. Okay, na? So in that, you have to just remember that nitrobenzene, it is the moiety that is responsible for antibacterial action. Okay, so after that, its pharmacokinetic properties. Okay, it is completely absorbed orally, as we have learned, as we have seen in its name only. After that, it penetrates blood CSF barrier easily. Okay, it crosses the placenta, and when it comes to metabolism, it forms the conjugation with glucuronic acid. Okay, so in this point, like you have to just remember that what is basically its absorption. After that, can it penetrate the blood CSF barrier, triple B or placenta? So that it crosses the blood CSF, blood placenta also. Okay, so after that, the adverse effect, there are so many adverse effect, bone marrow deterioration. After that, some type of super sensitivity reactions, or that something like that. But you have to just remember one keyword, that is the gray baby syndrome. When it comes to gray baby syndrome, like examiner asks that which of the following it is the generally a common a syndrome of chloramphenicol. In that case, you have to just tick gray baby syndrome. Or either this question can be asked like that: gray baby syndrome, it is an adverse effect of which of the following antibiotic? In that options, there will be lot of antibiotics in that option, that they may give chloramphenicol, penicillin, sulfonamides. Then you have to tick chloramphenicol. Okay, so coming to the next portion, that is the uh, there are two formulations present in our market, that is the chloramphenicol palmitate and the chloramphenicol succinate. So when we see about chloramphenicol palmitate, so palmitate, it is an insoluble tasteless ester form. Okay, na? So it is the inactive form. And after that, the pancreatic lipase, it hydrolyzes it in the intestine. The enzymes that are present in our body, lipases, that it hydrolyzes this chloramphenicol palmitate in the intestine. And when we see on the other side, that is the chloramphenicol succinate. So from succinate, you can understand that this succinate, it is a soluble ester form. From this yes word, you can also you can like remind that This is the soluble ester form. After that, it is an inactive form like that palmitate only. But in this case, the pancreatic lipase enzymes, it hydrolyze it in the tissues. But palmitate, it was hydrolyzed in the intestine, and these are hydrolyzed in the tissues. So, like we have seen that its mechanism of action, after that is adverse effect, but most probably the resistance of antibiotics. So when it comes to chloramphenicol, because most of the examiner like also ask that, because when we are taking this chloramphenicol again and again, there there is possibly chance of resistance of that chloramphenicol. Okay, na? So this chloramphenicol resistance Salmonella typhi has occurred due to transfer, due to R factor by the conjugation, due to of transfer of the R factor, due to transfer of R factor by conjugation. And after that, there is the acyl transferase enzyme. It inactivates the chloramphenicol. This is also one of the enzyme that inactivates the enzyme. Okay, na? That inactivates this our drug chloramphenicol. So from this slide, you have to just highlight 3 to 4 words, like 3 to 4 key points. You have to, so the message, from the message take away, the message take away home from this video is that there are some basic points you have to remember. One is that the oral absorption. Okay, na? So it's oral absorption. So it is obtained from bacteria Streptomyces venezuelae. After that, it binds to the 50s ribosomes from the P sites. Okay, na? After that, gray baby syndrome. It's most common adverse effect, that is the gray baby syndrome. And there are two forms of, that is palmitate and succinate. So succinate stands like succinate. You can remember that succinate, it is the soluble ester form. And after that, resistance, which is the enzyme that is responsible for producing the resistance of this chloramphenicol antibiotic, that is the acyl transferase enzyme. Okay, so with this, thank you. Keep keep exploring, keep learning. Thank you.